Hello everyone, I am Dr. Vishesh Gupta. Today's topic for my lecture is Class 1 cavity preparation for dental amalgam. The first question come to our mind is why we restore the teeth. Teeth should be restored in order to remove diseased tissue, to restore the integrity or the form of tooth surface, to restore the function of that tooth, and to restore the appearance of that tooth. Coming to the objectives of cavity preparations, the first objective being to remove all the defects and provide necessary protection to the pulp. Second, extend the restoration as conservatively as possible. Third, provide a restoration so that under the force of mastication, the restoration should not get fractured or displaced. Fourth, allow for aesthetic and functional placement of a restorative material. Now we are going to discuss Dr. G.B. Black classification from class 1 to class 5, and class 6 was given by W. J. Simon in 1956, which was added later on. Dr. G.B. Black class 1 preparation includes occlusal surface of posterior teeth, occlusal two-thirds of the facial and lingual surface of posterior teeth, and the lingual surface of maxillary incisors. The indications of class 1 cavity preparation for dental amalgam includes when there is a defect which is not in the area of aesthetics, a defect which is moderate to large, it is in the area which will have heavy occlusal contact or load, area that cannot be well isolated. In all the cases, it is indicated. Class 1 dental amalgam restoration is contraindicated in aesthetic area cases or where the caries is minimal, incipient or superficial. Coming to advantages, the dental amalgam gives a high compressive strength. It gives excellent wear resistance. It has a long-term clinical life and it is very economical as we compare it to composite restorations. The disadvantages of dental amalgam are first being it is a non-aesthetic material, second it requires a less conservative approach, third it weakens the remaining tooth structure, fourth it is more technique sensitive tooth preparation, fifth it has got micro leakage property, sixth it causes discoloration, and last it has a poor edge strength. Now, what all equipments we need for a class 1 cavity preparation? First, we need the basic instruments, that is mouth mirror, straight explorer, double-ended explorer, and William probe. Secondly, we need a spoon excavator, preferably circumferential. Next, we need carbide burrs, number 245 and 330. And we need ultra speed and conventional speed contra-angle handpieces. After we do a dental amalgam restoration, we need polishing points and cups. Now, class 1 cavity preparation can be divided into two stages. First, initial cavity preparation, and second is the final cavity preparation. Under initial cavity preparation comes outline form and initial depth, primary resistance form, primary detention form, and the convenience form. Under final cavity preparation comes removal of any remaining infected dentine or old restorative material, pulp protection if needed, secondary resistance and detention form, procedure for finishing external walls, and finally inspecting cleaning the cavity. Now coming to the initial depth and outline form. It is an imaginary outline form that is shape and extent of the future restoration by extension of the external walls to a sound tooth structure while maintaining a specific depth that provides resistance and detention form. The outline form should include all the faulty or defective occlusal pits and fissures. The initial depth of 0.2 mm to 0.8 mm pulpally of the DJ or normal root surface portion should be followed. Features of the outline form includes initial depth, that is half of the 245 number burr, which is 1.5 mm. Marginal ridge preservation, that is 2 times the width of burr, that is 1.6 mm. Facial lingual extension should be minimal. Enameloplasty, if required, will be done in cases of very shallow retentive fissures or grooves. We will connect the two close carious lesions if they are of less than 0.5 mm apart. Isthmus width will be 1/4 of the intercuspal distance. If caries extension is extending to one or the more cusps, we will consider cusp capping. The next step of cavity preparation is primary resistance form. It is defined as the shape and the placement of the preparation walls that best enables both the restoration and the tooth to withstand masticatory forces without a fracture, being delivered principally along the long axis of the tooth. Features of primary resistance form includes flat floor and perpendicular to the long axis of the tooth. Cavo surface angle should be 90 degree, that means butt joint. Internal line angles should be rounded. Capping of weak cusps. The restorative material bulk should be 1.5 to 2 mm and weakened tooth structure should be preserved. The next step is primary retention form. It is defined as the shape or the form of conventional preparation that resists displacement of the restoration from tipping or lifting forces. Now, what are the primary retentive features we give in a cavity preparation? First is occlusal convergence. That means the facial and the lingual wall converge occlusally. Second is occlusal dovetail. And third is conservation of marginal ridge. Next step is convenience form. It is defined as the shape or the form of preparation that provides adequate observation, accessibility, and ease of operation in preparing and restoring the tooth. We have covered the first stage of the cavity preparation. Now we will study second stage, that is final cavity preparation, under which comes removal of any infected dentine or old restorative material, pulp protection if required, secondary resistance and retention form, procedures for finishing external walls, and cleaning, inspecting and sealing of the cavity. The removal of remaining defective enamel or infected dentine can be done by two ways. First, we can do it by a spoon excavator, preferably discoid type, or we can do it by a slow speed revolving round carbide burr. While using a round carbide burr, we have to see that whenever the tooth structure feels hard or firm, we will stop at that point. That means only the infected caries or a defected caries structure has been removed and the healthy structure is there. The next step is pulp protection. The criteria for pulp protection is as follows. If the cavity preparation is of shallow depth, that is the remaining dentine thickness is more than 1.5, then no pulp liner or subbase is required. If the remaining dentine thickness is from 0.5 to 1 mm, then a thin cavity layer, that is liner, under a hard base, preferably zinc phosphate cement, has to be given. In case of a very deep carious lesion, a subbase, preferably calcium hydroxide, of minimum 1 mm thickness is placed over a base, that is zinc phosphate, which is placed beneath the temporary cement. The ability of calcium hydroxide to stimulate the formation of reparative dentine makes this material a choice. After pulp protection, we will go for a secondary resistance and retention form. This can be of two types, mechanical preparations or by treatment of preparation walls with etching, priming and adhesive material. Under mechanical preparations, slots, retention grooves or locks, and pins can be given. Slots are the horizontal box type shallow depressions which is of 1 mm deep in the occlusal cavity. Retention grooves or locks are the vertical shallow grooves of 0.2 to 0.5 mm on axiofacial or axiolingual line angles. Pins are the external devices that provide supplementary retention in the badly damaged tooth. Now this figure shows you a retentive groove preparation in axio-lingual line angle. Next step for cavity preparation is finishing the external walls. Now why we need to finish the external walls? First, to create the best marginal seal possible between the restorative material and the tooth structure. Secondly, to get a smooth marginal junction, to provide maximum strength of both the tooth as well as the restorative material at or near the margin or a junction. It is important to provide an approximate 90 to 100 degree cabo surface angle, which should result in 80 to 90 degree amalgam at the margins. The last step of cavity preparation includes the final cleaning and inspecting the prepared cavity. Every completed prepared cavity should be inspected and cleaned before the restoration. The preparation should be free of debris and should be isolated before insertion of a restorative material. Sealing of dentinal tubules can be done by a gluma or a 2-coat of varnish that will be applied only on the walls. Coming to the conclusion of my lecture today, I would like to provide a table which will tell you all the provided features required for a class 1 dental amalgam cavity preparation. To conclude my lecture, this is the table which I'd like to present in front of you, depicting all the steps of the cavity preparation of a dental amalgam cavity versus a composite cavity. Thank you all for patient hearing. Thank you.